Let's be honest. Nigerians don't like to talk about sex, but they like doing it. Let's just be honest with ourselves. Hello, my Red Tribe, and welcome to another episode of Dr Red Diaries. Welcome to the month of love. This month, we're going to be talking about health and things that, if you're in a relationship, married couple, that you need to be discussing and having together. And let's get right into it. Let's be honest. Nigerians don't like to talk about sex, but they like doing it. Let's just be honest with ourselves. So many couples enter relationship, marriage, and they don't discuss these topics. What are these topics? Sexual history, STIs or STDs, libido, differences, pain during sex, pain after sex, bleeding during sex, bleeding after sex, and especially family planning. There was a time I was really a very strong advocate for family planning. And for a reason though, I would most like to talk about it for a reason why, because I think it's an important topic to really talk about planning your family. So let's just get right into it. What are some of the common sexual health issues in Nigeria? Erectile dysfunction is common. And I'm speaking based off of research, based off of a lot of people that visit the hospital every time, and based off of even personal interactions and treatments, so to say, condition that I have done. Number 2, STIs, sexually transmitted infection or sexually transmitted diseases. We're talking about gonorrhea, chlamydia, syphilis. These diseases are common in Nigeria, but we don't tend to shy away from these topics. Number 3, which is also a very important topic to have, is libido differences. We've seen, again, this is a very important topic, so please go along with me. We've seen men might have high sex drive compared to women, but I have met women that have a much more higher sex drive than men. So it's important to have this conversation so you both know exactly what you're getting yourselves into and where you are heading to. So to avoid issues and challenges along the way. Another common illness for women is HPV. That leads and causes cervical cancer. For example, in the US, cervical cancer is now one of the most common cancer for women recently. So it is a topic that you need to discuss, you need to have. Again, not to create fear for the other person, but so that both of you will be aware, run investigations, do tests, and just prepare yourselves. Another common sexual health condition is painful intercourse and vaginismus, rather. That's what's called. Vaginismus and painful intercourse is also common. It's always common for the women. So women that have vaginismus as a medical condition and they have pain when they have sex, it's a condition that should be had. There's some women that were mutilated, for example, at a young age. It's important to share such information with your partner so they are aware and you guys can be able to have this discussion and know what to do further ahead the road. The next thing is mismatched sexual expectations. I know you'll be wondering, what are they going to do with health? I'm getting there. Because these things are all encompassing. They are common. They are common sexual health issues we deal with in Nigeria, but they are not talked about. And they can lead to so many things. Let's start with STD or STI. Research has shown that STI is one of the major causes of infertility in Nigeria. It's one of the major causes of infertility in Nigeria. And most times people don't get to find out until when they're married, when they've been married for years, they've tried having children for years, they've done some other maybe tests, but they didn't do some tests to rule out some STDs to find out from either the woman or the man. Why? Because they are scared, fear. But I think it's an important conversation and information to have. And it can lead to infertility, it can lead to pregnancy complications, even chronic pelvic pain for women. So if you're always having chronic pelvic pain and you're sexually active, it's important to run some of these investigations just so you are aware. Again, not to create fear. The idea of this episode is to create awareness and to get people to start talking about the most uncomfortable things. It is very, very important. It is very, very important. Sit down, have the conversation, talk about it. Talk about it. So now, what are some of the important tests that couples should consider doing? Number one, it's important to have HIV screening done. I talk about it all the time. Most of you should have HIV screening done. Hepatitis B and C done. STI or STD panels, there's a host of them. You can go to a very good lab to have it done. VDRL rules out syphilis. You can have that done. For women, you can have HPV screening done. You can have this test done to really save you from future problems and issues on the long run, especially married couples. You're married, you've never had this test done, either you or your partner. This is a great time. If you are seeing this episode, it is a great time to have the conversation. It's a great time to start discussing it. If you've not watched one of the episodes I did about pre-medical screening, that's for people that are about to get married, pre-wedding medical screening, watch this one. Go and watch that one. Put everything together. Discuss with your partner. You guys should go and do tests. Sexual health is not just all about sex. It's about safety. It's about trust. It's about communication. But it is very, very important. So if you're planning a wedding, if you are married, you need to have sexual health conversations. You can't shy away from it. You can't say, I don't want to know my number of body counts, as they would call it, or whatever it is. You cannot shy away from it. If you were previously treating hepatitis B or C, or taking HIV medication, or treated any form of STD, please give that information to your partner now. Why? Because it's possible that it was not even treated properly in the first place. Number two, it's possible it's still there. Maybe that's what is even causing or would cause infertility. You can't be too sure. You can't know. So like I said, if you're watching this video, use my voice. Use Dr. Red let Dr. Red's voice be sounding in your ears that, oh, I need to have this test done. If you're single, you also need to do those tests. You need to be aware of your health. Health is wealth, but you need to be aware. Thank you so much for watching today's episode. I'll see you in my next episode. Bye.